and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, we did a detailed analysis in yesterday's program, and so much of feedback that we got from all our viewers talking about how important it was to understand the difference between the two waves, the first wave and the second wave in the country. But then all of you wrote to us trying to understand what exactly is the Maha factor all about. Why is it that time and again, both in the first and the second wave, we keep looking at states like Maharashtra with the maximum cases? Ironically, the states which have the maximum seropositivity as well. Seropositivity meaning that maximum people in a concentration place where already antibodies are present. How is it that there alone we are seeing more cases? So the Maha factor, why is that happening? That is what is going to be our focus on the program today. So let's look at the first graphic to try and understand what exactly is it, how is it placed in terms of numbers. So if you look at the first wave and the second wave in terms of numbers in daily rise, look at that. It's such a huge jump in the second wave altogether. In the first wave, around September of 2020, the maximum number of cases we got in a day were about 24 to 25,000. Cut to the second wave now, where more than double, 57,000 are the cases we are getting in one single day. These are numbers from the 5th of April. And like we said, it's not just important how many numbers we've reached, but look at the steep rise over here as well. If you go to the next graphic, you'll see how quickly we have climbed up the numbers in Maharashtra at least. So from 0 to about 538 at this point. I think that number is a little faulty over there. 50, we'll just check on that. But about 140 days it took for the numbers to go from that to the first peak of the wave. And look at that. The second peak of almost 58,000 has been reached in less than half, 52 days over there. And it's not just the numbers, it's not just the daily spike, but how quickly it's going, but the number of deaths as well. Now, at the look of it, it might look like that in the first wave, there were roughly about 515 deaths in a single day. Currently, in the second wave, we are seeing about 481. Not so much of a difference, but again, go back to the advice we got from our experts on yesterday's program where they said that, listen, we haven't reached the peak of our second wave just yet. Numbers on lives that we're going to be losing in the second wave only set to go up as more and more people reach hospitals and are in ICUs. So this is the number of deaths at the moment, little less than the first wave, but we can't concretely say what it will be like in the coming days to come. Now, look at this graphic. Since we are talking about Maharashtra, the first wave, we saw these districts. We saw Nashik, Thane, Mumbai, Raigad, Pune, Aurangabad, Nagpur as the worst impacted. Remember, seropositivity survey was also done and they saw large concentration of antibodies in these areas. Despite that, cut to wave 2, almost the same districts. All the districts but one is where we are seeing more and more cases this time around as well. Isn't that really bizarre? Why is that really happening? That's something we'll also try and find out on the program today. But if you look at the overall percentages, if you look at the positivity rate, during the first wave, it was about 24.6. We are already at 23 when, like I said, we've not hit the peak just yet. Look at the average number of daily tests, because that tells you the main picture. Remember, yesterday, the feedback we got from our experts was that we have to look at testing as well to try and come to an actual understanding of, is it that we are getting more cases because we are testing more? Well, clearly looks like at the moment part of the thing, because 85,000 is what we had. We were testing almost on an average of daily cases during wave 1, but 1.6 lakh in wave 2. Recovery rate much better when it came to the second wave, and the fatality rate also a bit lower. So this is good news at the moment. Let's look at the last set of graphics really to make you understand more on testing. And this is to give you an understanding that look at all these figures over here. Amongst all the states in the country which are said to be problematic states, one state that is testing almost 93.7% of their, and our RT-PCR testing is Karnataka, then it's Maharashtra, before that it's Delhi. So amongst the states, Maharashtra also a state which is testing at a huge capacity and also, remember, vaccinating at a huge capacity. The next graphic will tell you about that, on how the vaccination numbers are actually stacked up. This, of course, is about 7 out of the 10 districts are most active in Maharashtra. Again, across the country, you look at the numbers, most of them coming in from this very state. Why? We'll get an answer on that. Let's go to the next graphic very quickly, where we have the vaccination numbers really, and that tells you a clear picture. Look at that. Maharashtra vaccinating the most in the country amongst all the problematic states. Despite that, you see the numbers go up. They are testing more, vaccinating more, and even have the maximum amount of seropositivity in terms of pockets that we look at. Yet, there is no respite in the number of cases that we are seeing even in the second wave. So why is that happening? Let's break it open to our guests. What we've done for you is we've got doctors from the hotspots for you. From Mumbai, we've got Dr. Farah Igle. She's the Director of Internal Medicine at Fortis Hirandani Hospital in Vashi. She joins us from Mumbai. From Pune, we've got Dr. Mahesh Lakhe. He's the Internal Medicine Infectious Disease that he joins us from there. And from Delhi, we're always very delighted to have Dr. Shahid Jamil to give us an overall perspective on how things are really looking at and why Maharashtra. My first question, Dr. Shahid, is to you. When you look at all these pictures that we've just looked at the moment on why Maharashtra, could you talk to us about 2-3 key factors? We obviously don't have data on variants, which is said to be the key over here. But apart from that, what do you think are these trends telling us at the moment?
Well, as you said in your graphic, I mean, Maharashtra seroprevalence, certainly we found antibodies at a high level. But remember, not all of Maharashtra, not all of Mumbai even. If you recall, places like Dharavi had almost 60%, whereas the upmarket areas of Mumbai had only about 15 to 20%. So clearly one thing that is happening is that there are still a lot of unexposed people from the first wave who are getting exposed this time around. Why are they getting exposed? Well, they could be behavioral factors, COVID fatigue, everything has opened up, suburban trains are running, everything's opened up. Parties are happening, weddings are happening.
That's happening across the country, no, Doc? That's happening across the country. Why only Maharashtra do we see a spike time and again?
Well, I mean, there are other states also that are showing that. But you can't take the mutant viruses out. Yes, the epidemiological correlation hasn't really been done fully, but all indications are that mutants may be responsible for some of this surge. By the way, the double mutant that has been seen at 15 to 20%, and I have no reason to believe that this number will not go up. My prediction is that in the next couple of weeks, this number is going to increase dramatically. This virus has also now internationally been assigned a new lineage. That's the only lineage that is now available from India. An Indian lineage, it's called B.1.617, a brand new lineage that has emerged in India. So I think it's multiple factors that are contributing. You also said that Maharashtra is vaccinating the most. Yes, in terms of numbers, but only about 4.8 or 4.9% of people in Maharashtra have received one dose. So it's a large population also. Even though the doses may be more, but in terms of percentage, it's still far less. Maharashtra has also been testing very well, but remember the test positivity rate of Maharashtra at this point is roughly 25, which means that out of every 4 people you test at random, 1 comes to be positive. So that's quite alarming.
Right. Alarming indeed. Let's get a ground update now. Dr. Farah is joining us from Mumbai. Dr. Farah, first up, I want to understand from you, when I spoke with you earlier, you said this time around in the second wave in Mumbai, you're seeing certain new trends emerging. We've discussed in the program earlier as well that more and more young people this time getting infected. But you said something very interesting. You're saying it's not just getting infected and thinking that it's younger lot, so they will get rid of it easily. You're saying the virus just might be more virulent as well this time around, meaning it's more dangerous in a way. I don't want to say deadly just yet, but more dangerous.
Exactly. What you said is completely right. This time, the virus which we are dealing with, as Dr. Shahid has already said, we are dealing with the mutants. We are dealing with double mutants, the variants. And this time, if you see, the virus is affecting people from upper middle class and higher class. Not like the last year when lower socioeconomic status people were more affected. So what I feel this time, and this time we even have children who are getting more affected. Last time children were not so affected. This time children are getting more affected and they are more symptomatic.
You mean what age bracket really?
You can say less than 15 years of age.
Oh, really?
They're getting more affected, yes. And they're more symptomatic too. And as it is, if you see in COVID, about 60 to 70% of people who suffer from COVID infection are actually asymptomatic. So they themselves don't know that they are suffering from the virus and they transmit the infection to another person. In fact, one person can affect 9 people and those 9 people can individually affect another 9. So it multiplies and that could be the reason for steep rise of cases.
But Dr. Farah, can I understand this from you? From when did you started seeing this trend that children were getting more affected? Do you have a month where you considerably saw more children getting affected?
Yes, because we have been managing the COVID cases right from day one when it started here as the pandemic. What I've seen is from the second week to third week of February, actually, the cases have started going up. And this time
that is around the time schools opened, actually.
Yes, that time the schools had opened up. And that time we see the number of cases going up in adolescents and children. The age group of the children are getting more affected this time. That's what we've seen.
And there is no vaccine out there for kids. How are you treating these kids then?
So children we do treat symptomatically. They do not require that much of aggressive treatment because they do not present with serious illness. We have also seen people more between the age of 35 to 45 getting affected this time, and mortality is also more between the ages of 35 to 45. So what I would recommend is, because all those children above the 18 years of age had been included in the trial of vaccines, they should all be vaccinated if you want to break the chain. You know, because we are vaccinating, but we are still not at our optimum. We need to speed up vaccinations.
Well, we've been saying this on NDTV time and time again that it is time to open up. But if today's health briefing is anything to go by, it doesn't look like the government is in a mood to open it up for anyone. Before I go on break, quickly want to get in a word from Dr. Lakhe as well. Dr. Lakhe, similar question to you. In Pune, is this a similar trend that you are seeing? You told me earlier that it is clearly a trend where you're seeing younger people stay in hospital, stay on the ICU for much longer, finding it harder to beat the virus this time around. But the question also from Pune is, what about reinfections? Because there are so many seropositivity cases there. Are you seeing more reinfections?
Yes. Thank you for having me on the show. As Dr. Shahid and Dr. Farah has rightly said that, we have been seeing younger patients, more families, actually entire families getting infected. Apart from that, reinfection cases, around 1 to 2% of reinfection cases we have been seeing in last, say, a month or so. But, luckily, we have not seen any patients with reinfection getting sick and, getting into the ICU or requiring oxygen. And having said that,
so patients with reinfection are getting the virus, but not a very dangerous form, is what you're telling us.
Yeah, so they are not getting sick enough to be in the ICU or so.
Okay.
Whatever small percentage of reinfection cases we are seeing. And apart from that, the seroprevalence study initially in the first wave, which have been done in parts of city of Pune. This time, I have been seeing that less number of patients getting hospitalized from those areas. But, there are other pockets As Dr. Farah rightly said, it's from the middle class and upper middle class families. The entire family is getting affected. Apart from that, last wave, we have seen more complications like thrombosis and bleeding related things. But this time, we have been seeing less, say, myocardial infarctions or strokes.
Lots of important news coming in. Remember, kids below the age of 15 getting infected in Mumbai more and more. Younger people, in fact, families getting infected together. What exactly is the solution then? That's coming up on the other side of this very quick break. Welcome back. On FYI today, we are discussing and trying to decode the Maha factor. Why is it that number of cases, maximum number of cases, keep emerging out of the state of Maharashtra? And some trends that we've got so far all indicate towards the fact that there is a double mutation, a new virus, a new mutated form of virus which has taken over the state, which is a real cause of concern. A virus which is impacting younger people more, kids more worryingly, and there is no vaccine for them yet, remember. And also ensuring that younger people are finding it much harder to beat it in the second wave. If I can go back to Dr. Shahid. Dr. Shahid, I have to, if I may, ask you a very direct question here. We are speaking on a day when the health ministry has clearly made it very clear that they're in no rush to open up vaccination for all. Not sequencing enough positive cases in the country, especially in the hotspot states, and not opening up vaccination for all. Are these two big gross errors that the country is indulging in at the moment?
Yes, I do believe that, sequencing is happening and sequencing will increase as time goes on because systems are in place now. Vaccination, we have to follow a more nuanced approach. Opening vaccination for the entire country, 18 and above, does not make sense. But opening vaccination for areas with surge, such as Maharashtra, such as Punjab, for everyone above 18 makes a whole lot of sense. So it has to be a nuanced approach that has to be balanced with the supply of vaccines. Remember, there are two vaccines available in the country. Covishield has a production capacity of roughly 10 million doses a month. And Covaxin has a capacity of roughly 3 to 5 million a month.
But then,
so it will take time to develop, to have enough vaccines to cover people.
But will both these vaccines, another direct question coming your way, I know there's been a lot of confusion about this, will these two vaccines work against the double mutation?
Well, I can't give you a direct answer because there are no direct answers at this point.
We don't know.
No, we believe in data. We should look at data. And here is the data. The data is that as far as the double mutant is concerned, all international studies show that antibodies in people who have received vaccines are less able to neutralize the virus. But remember, antibodies are not the only way to protect. There are T cells also, okay? So even if people will get reinfected, the infection is going to be much milder than the first time around. And that is what I am hearing from the doctors of the panel. So please don't discard the vaccines, saying that vaccines won't work. That is going to be a disaster if people start believing that these vaccines won't work. These vaccines work. And let me vehemently say this, that all vaccines in the world today show 100% efficacy against severe disease and death.
Right.
So this needs to be understood by people very, very clearly and not get bogged down in the 60%, 70%. Will the vaccine work on the mutant? Will it not work on the mutant? Because
all right,
that
so
message
three takeaways, if I have to wrap since I'm running out of time over here, 3 takeaways from today's program. One, we are seeing more and more cases of a new sort of a virus, so new sort of trends that are emerging in the second wave. We are seeing younger people get infected. We are seeing kids get infected and reinfections happening as well. And one appeal that is really going out from all doctors on the panel today is that we have to open up vaccination for all. We really hope the government is listening. That's it for tonight. See you again later.